On Call Africa, volunteer doctors visit villages in 3 regions of Zambia's southern province. These regions are Semengo, Katapazi and Mapatizia. The doctors visit once per month and people form a line and wait all day to see a doctor. While they wait, we can run health education programs for the patients and everyone around them. In order to make an impact in health education in Africa, we wanted to provide something that was really relevant, memorable and also entertaining. We needed to do something that was based on the actual problems that each individual faces. The village that we're in, Katapazi, decided that they wanted to tackle the really difficult topic of germs. It's really difficult to explain germs to people when they're invisible. How do you explain that something exists when you can't even see it? The idea was really hilarious to people with recurring diarrhoea. Why should they boil the water when it looked clean to them? Each roleplay requires a local interpreter and a cast of 4 from the community. Our Hidden Germs roleplay involves the central character of the lion and 3 village people returning home for the day. We chose to do roleplays because they're so much fun and anybody can get involved, whether you're old or young. You don't have to have any particular skills, you don't have to know how to read or write or even draw. All you have to do is get up and get involved. In the story, the 3 village people need to get home after a day of hunting, and the fastest way home is via the lion's lair. The lion is hiding and the villager cannot see him. As the lion can't be seen, he must not be there, and so the villager takes the shortest route home.
They can't see the lion. But they know that sometimes the lion can be there, so they carry a stick. Maybe even if the lion attacks, then they can still try and get away. You're hurt now. So she gets away from the lion, but she's injured. They can't see the lion anyway. Do you want to walk that way? No. It's a bad idea. Where should you go? You go another way. So they choose another way. And then they arrive home safe. Yay! They're strong.
It really was an amazing thing to be able to watch people open up and start acting parts and doing things that they'd never done before, and see all their friends and family around them start clapping and cheering and egging them on a bit as well. The story demonstrates prevention rather than cure and teaches that sometimes it's best to minimise risks in order to maximise your health, even if you can't see the threat at the time. This applies directly to hygiene and hand washing to prevent spread of contagious illnesses and germs, and we finished the class by washing our hands together. After we finished that role play, we had people coming up to us, suggesting things, saying it was one of the most fun things that they'd ever done, and also saying that they could think of the next topic that they wanted to do. I couldn't believe that after weeks of trying to do lots of different things such as writing and making posters and drawing pictures, we'd broken through with such a simple form of communication. It'd be really fantastic if we could continue role plays as a form of health education. It really seemed to open everyone up and get everyone excited, and that's one of the main things that's so important, is helping people become responsible and take charge of their own